Hi, I'm Dr. Mike DiTolla, and I'd like to welcome you to this episode of Inside Dentistry's Product Talk. We are virtually on location in Ponte Vedra Beach, Florida, with Dr. Jason Olitsky. Jason is an accredited member of the AACD. He's program director at Clinical Mastery, and he's the official dentist of the NFL's Jacksonville Jaguars cheerleading team, who is called the Roar. More on that in a second. And we're here today to talk to him about Parkell's Predicta Bioactive Bulk Fill Composite. Jason, thanks so much for taking some time to speak with us today.
Thanks for having me on, Mike.
Jason, composites have a long history of just being kind of an inert material being put into a cavity preparation to fill a hole. But Parkell's Predicta Bioactive Bulk Fill is a great example of bioactivity. It releases fluoride, calcium, phosphate ions to stimulate appetite formation and remineralization at the tooth composite interface. Does the idea of a restorative material that's more than just a filler in a hole, does that make sense to you when you first heard about this category of products?
Like, it makes sense to me, but I had never thought about it before. It wasn't a category that even entered into my thought process until I was connected with Parkell. And, I thought to myself, this is something I got to check out because I didn't know a lot about it. And I just deep dived into the research for this. I spent 40 hours researching bioactives. And at the end of the day, it makes sense to, why are we treating teeth with inert substances when we could be treating teeth with restorations that are working with the tooth to create more positive situations in the oral environment?
Yeah, and there's certainly no negative consequences to using it. And these are all present, in the saliva or in and around the tooth as well. So it does make a lot of sense. And I'm guessing that, like me, you were probably taught, whether it was in dental school or afterwards, that for posterior composites, we were putting 2-millimeter increments and building our way from the proximal box floor and the pulpal floor up to the occlusal surface. The technique works, but when you've got a whole quadrant of operative that you're doing, it takes a lot of time. Talk to me about the experience of bulk filling a couple of direct posterior composites versus the incremental placement.
Yeah, sure. So incremental placement takes forever, especially when you use halogen lights and 40-second cure times. And then it introduces chances for voids and failures and things like that, where we have, incomplete layering throughout the process. So the idea of bulk fill, I really like, and I adapted the idea of bulk fill. And so what it does is it really speeds things up, and it reduces your chances for failure when you're placing the restorations. So I'm a big fan of bulk fill.
I think there's nothing worse as a general dentist than post-operative sensitivity. And so it's always a concern when we're taking out an old deep amalgam that's got a deep proximal box. And I think we all, if you understand that the curing light tip is sitting on the cusp tip, so it's already 3 millimeters away from the surface of the composite, and then maybe we have a 7 or 8 millimeter deep proximal box. You're always worried that you're going to have uncured composite against the tooth, and that definitely causes post-operative sensitivity. Do you like having a material like Predicta where it's got an unlimited depth of cure since it's a dual cure material?
I don't know that there's a lot of materials out like this. I mean, this is my first experience with a dual cure and a light cure resin material for restoration. And I love the concept because I know that there's a lot of failures due to incomplete curing, especially at the bottom of boxes where secondary caries occur. And the peace of mind that you get, that you can actually place just one whole increment all the way up to the top and know that this material starts dual curing from the bottom up. So you've already started the initiation of curing at the bottom, so you know that's going to get cured. And then you can light cure from the top, and the light cure reaction starts from the top, and then you got this monolithic restoration that you know is cured top to bottom. I mean, there's a lot of peace of mind in that. I mean, it's challenging to sit there with the light and make sure it's on the right spot, as you said. And then it takes even more time to take the band off and cure it from, both the proximal sides to make sure those boxes are cured. And this takes care of that and gives you that peace of mind.
Yeah, it's a lot of hoping and praying and trying to get it from every angle and trying to attack it so that the deepest part of that preparation, whether it's on the pulpal floor or the proximal box, hopefully the light's getting there. But with this, we really don't have to worry about it with that dual cure mechanism. So you were nice enough to share a case with us. So let's go ahead and take a look at this. And why don't you go ahead and walk me through these slides? It looks like I see some incipient caries between those two molars.
Some proximal caries between 30 and 31. Yeah, on the distal 30 and mesial 31. And so having the product for a short amount of time in my practice, I found the patient, fortunately, that I could do the class 2 restorations on, because I really wanted to test this product in a class 2 situation. And so, rubber dam isolation and preparation design, just, dropping the boxes, removing the decay. I think this is an important part of a good class 2 is that you have good access for the band, so you get a good seal. I beveled the enamel margins and I particle braid the dentin with a prep start in there to clean everything out, and then
Nice.
selectively etch the enamel. I don't etch the dentin. I selectively etch the enamel, and
Hmm.
then after I selectively etch the enamel, clean that out, and I use a universal adhesive to as a bonding agent, and make sure you place that adequately so you get a good seal, air thin that, light cure it.
Let me ask you one question here. I'm looking at that second molar. I can't really tell how deep that area is on the pulpal floor towards the distal marginal ridge. I don't know if you put a perio probe, how like deep that was, but that is one of those areas I think where what you're about to bulk fill this in just a second on the next slide. That feels like an area where it's good to know you've got a dual cure material down in that deepest area.
That spot and the box, and that you didn't see on the radiograph. I didn't either. I was surprised. I didn't see anything on the occlusal, and I dropped that
Me
in. I'm like,
neither.
oh man, the guy's got cavity here too. So I was glad I opened it up and I was able to take care of it. But yeah, that's one of those spots that you're happy to have a dual cure. And then with this material, with Predicta, you want to place the tip of the syringe at the bottom of the box, the deepest portion of the restoration, and start injecting and keep the tip in the material as you're injecting. And so I did, like on the first molar, I did a better job of filling it, like it was just right there. But you're supposed to overfill it a little bit. So on the second molar, I overfilled it a little bit more. And what I've been doing typically in my office is I like to like put the perfect amount of composite in it, and I like to put the the anatomy into it and get the occlusion just right even before I check it. Like that's like my best filling that I could do. And so this was like the total opposite. It's like just overfill it and carve it in. And I thought, I don't know if I'm gonna like this. And then just I wanted to test the polishability. Had a nice polish. You contour the marginal ridges with the disc because you can't really do that as it's setting. You just want to let it set. You don't want to keep playing with it because it might pull away from the margins. Rolled the margins, and then I was pleasantly surprised with the aesthetics. I'm really concerned with aesthetics. This is like a one shade. I think it only comes in a couple shades. So this is like their A1 color.
And the radiograph, I love the radio opacity as well. Are you happy with how it
Totally
looks?
agree with the rate opacity. Like you gotta have radio opacity to see it, and it definitely checks that box. So very happy. Yeah.
All right. Well, Jason, thanks so much for spending a few minutes with us today. I really appreciate getting your input on the product. Thanks again.
Yeah, my pleasure, Mike. Thanks for having me on.
Well, that'll wrap it up for this episode of Product Talk. Thanks again to Dr. Olitsky for spending some time with us. So on behalf of Jason, myself, and all of us here at Inside Dentistry, I want to thank you for your time and your continued commitment to quality dentistry.